Good morning, good afternoon, whatever time of day it is. Hope you're doing okay today. Welcome to Women's Health Advocates monthly call. We do these calls the first Wednesday of every month at noon Eastern Time, 9 a.m. Pacific Time. And we like to give updates on what's going on in Washington and updates on what we're doing with Women's Health Advocates. So, this is the agenda we're going to cover today. And the DC updates. Next slide, please. Yep, thank you. Next slide, please. Okay, so tax reconciliation, it is pretty much done. I've actually been listening to the floor debate all morning. Um, Talk about theatrics. You think a soap opera is interesting? You should watch the House floor. It's been very entertaining, also depressing, but just fascinating. Um, what's happened? So the House sent over their version, and then the Senate had to do some cleanup because the parliamentarian ruled certain things are in order or not in order, which then impacted that top line. So while we thought about $800 billion cut in the House version to Medicaid was significant, it actually increased to 900 billion roughly in the Senate version because they had to compensate for that. And there's all kinds of, not to get in the weeds, but there's rules around what is germane and what is allowed in a reconciliation package. And that reconciliation package is so powerful because it just takes a simple majority. Whereas in the Senate, you can filibuster just about anything else. So that's why this had to be done a certain way. And the cuts had to increase further. So they have the work requirements, but they do have exceptions. To be fair, there are exceptions, and so that is what Republicans and on the House floor now they've been arguing back and forth on it. There are exceptions. However, that top line number um, is a cut, and there's no longer this guaranteed payment to the states. And states, as we all know, don't have the funds. So, with this measure, the states are no longer required to provide matching funds. So that's going to be the real challenge. Also, there would be 200 million for CMS, Centers for Medicare and Medicaid, as part of this bill. And then we also care about defense health because there's a lot of defense health research. There is 2 billion for defense health programs also in this bill, just to mention that as well. There's many other things. There's cuts to SNAP. There are estimations of 17 million people will no longer get Medicaid coverage. 3 million will no longer have SNAP. So all of this is unraveling now. We're at a point where this is going to happen. The House is voting on it today. And then they will do some huge ceremony, meeting that July 4th deadline of President Trump. So when I say negotiations are underway, there was an interesting pushback. So we had Senators Collins, Paul, and Tillis, three Republicans, vote against this package in the Senate. And Tillis also announced he's not running for re-election. So he's willing to stick his neck out more, and he felt very strongly about rural hospitals. Interestingly, on the House side, also Republican members are concerned, and Dr. Murphy, who's also from North Carolina, is one of those members. So I think that there's still some effort to try and do something, and what they might do is slip it in like on administrative side or in appropriations bills, which are yet to come. So we will see what happens, but this is where things are now. Doge. So we talked about all those cuts that have happened, the efforts to save money, efficiency. What's happened is the courts have now pushed back since we last met with you all. So the courts have reversed some of the NIH grant terminations. They only reversed those that were actually listed in the lawsuit. So it's not all of them. And it's kind of hard to get that actual list, but I'm sure it'll come out. And the ruling was because it was arbitrary and capricious decision making. And then also the HHS, Health and Human Services firings, were also reversed because they caused irreparable harm. So these are going to be appealed. There'll be more back and forth on it, and ultimately things will probably end up at the Supreme Court. And so we will see what happens there. The FY 2026 appropriations process, which starts, the process is underway, but the actual year starts October 1st of this year. So that sort of was stalled because of this tax reconciliation package. But the House still moved forward with doing some committee activity and markups. The Senate did hearings. And so we're seeing it's been very frantic at G to G on our team as we're working to respond to opportunities to do amendments. So there still is a ways to go on this. And now that reconciliation package is going through with the chair of the Appropriations Committee in the Senate, Susan Collins, opposing it, it is going to be very interesting to see what happens in the final appropriations process. So there's still a lot to happen, but this you can see those numbers. There are lots of cuts: 23% cut to domestic, and then 13% increase to defense spending. You see HHS goes from 121 billion down to 80 billion. The $500 million for the new Administration for Healthy America, which is RFK Jr.'s baby. And then NIH would get a 40% cut. But this is all in the president's budget proposal, and we will still see what the committees do to respond to that. So just keep that in mind. Interestingly, we had a chance to do a back and forth on a floor amendment for the VA to do a full assessment of all their spending on women's health research. It's pretty exciting. Teamed up with Congresswoman Marionette Miller Meeks, who came and spoke at our May 21st Capitol Hill Day. There was this frantic back and forth. We had to meet at a noon deadline. It got the amendment in, but didn't hear back from them. Finally, that night, thinking it's not going to happen, the chief of staff communicates back, it's in. We submitted it. I'm like, great. And then the next day, the Rules Committee comes out with the amendments that they are allowing in order, and we did not make the cut. So just so you know, there's a lot of things that are happening behind the scenes with our team as we're trying to navigate and insert things to advance women's health. Sometimes we win, sometimes we don't. We're continuing to work on that. And then finally, we did talk about this last time, but that rescission of the Biden guidance for emergency abortions, pregnancy loss, complications, miscarriages, that type of thing. We do have a letter on our advocacy tool if you still want to send that in. We have new advocacy letter as well. We're going to talk about it in a minute. There's also been some women's health legislation, like Senator Gallego just came out with this fairly recently that would require postpartum Medicaid services and coverage that full first year to help compensate for what's happened with Medicaid cuts. And it probably won't go anywhere, but just the fact that he put it out there is important. There's been some other bills we're going to talk about. There's lots with breast cancer happening. We're going to be talking about that all on our Capitol Hill Day on July 16th. But so there's, it's kind of a step forward, a step back. That's the process with the Hill. And a lot of times bills get introduced. Nothing happens with that bill, but the language is pulled out and turned into an amendment. That's a lot of what we try to do with things. So we're strategizing on how best to respond to this reconciliation and next steps and how to really shape appropriations and even some authorization bills in response to that. So anyway, that's the quick of, although that wasn't very quick, of what's happening in Washington right now. So next slide, please.
Liz, I have a I just wanted to mention to people, first of all, you are amazing. And the fact that you can break that all down to help us understand is, I mean, we're so grateful. But if anyone has questions, please put them in the question box because if we can't answer them today, we will certainly see them and we're going to try to start answering those. So put your questions in the in the Q&A box. That's all I wanted to say.
Okay, next slide, please. So next slide, please. On July 16th, we have our Capitol Hill Day. We're really excited. This is a really nice follow-up to our May 21st Capitol Hill Day. So this just gives an outline of the day. And after this open to all call, we'll have our steering committee call. We'll get into more details. And we're doing lots of communications with those of you who are coming in for this special day. So thank you, thank you. Even if you're not coming, we have a role for you. We're going to talk about that. You can still play an active role in supporting this day. So first off, we're going to have our lunch and an advocacy training. And we've got Ruth McDonald, who's the health policy advisor with Senator Amy Klobuchar, who is going to speak to us about what's going on with the Find It Early Act, give us tips on advocacy. We can ask her questions. She's wonderful. Katie and I've worked with her for many, many years, a big women's health advocate. So excited for that. Then we're going to break into groups. So we're going to have 6 groups with one group leader for each group. And you're going to be with your group the entire day. So you do not have to worry. You just follow your leader and you're good to go. And the group leader will give coaching on like unique things about this member as you walk in, before that meeting. So we know things to emphasize, all that type of thing. So there will be lots of coaching and teamwork in this effort. So you feel really confident going into those meetings and we have a clear ask. We've already prepared the handouts where we summarize the Find It Early Act and the impact, and we really highlight one of our most important leaders who's been a huge instigator and financial supporter of this effort, and that's Sheila McHale. So we highlight her story in one of our handouts about the importance of Find It Early Act, but we know this touches many of you, many of us, people we love. We just thought her story was a great way to highlight that. So that's one handout, and then the other handout lists all the different breast cancer legislation that's out there, a quick summary, the members that are co-sponsoring it, and what and our request that they co-sponsor it. So we've got that ready for you. And then at the end of the day, we're going to close out, and we know some people need to travel home. Madeline on our team has asked all that are coming those details so we know how many softball tickets to get. But we'll meet up at 5 for those who can do it, just to share some refreshments, cool off, and connect before we then go over to the softball game. And this is an annual event. It's the women members, bipartisan women members play against women in the media. And it's sort of a fun gathering. It can be great networking. It's sort of fun. People are in t-shirts and shorts. You don't have to be formally dressed. We will all have our brand spanking new t-shirts that Vanessa designed. Super excited for the big reveal on the 16th. And then we will, talk to members wherever we can, sort of make sure we elevate what the coalition is doing and how we want to work with them. So that's what's happening on the 16th. And I think the next slide is listing our upcoming events, which I would love to pass to Leslie.
Thanks, Liz. Echoing what Vanessa says, thank you for doing all of this work. Um, Over the last week, I think I've had 4 or 5 conversations with different chapters, regional chapters, and thank you all for raising your hand to participate. And those of you who are on this call and were not aware that we're doing things in different markets, you'll see on the next slide how to get more involved. But next week, the Pittsburgh chapter has organized a webinar for all that will look specifically at the importance of research. And though they have initiated that through the Pittsburgh chapter, it is, as I mentioned, not only open to all women's health advocates, but also to a broader community. So feel free to share the information. You'll see posts on LinkedIn and Instagram. If you could echo that and invite more friends of yours, that would be fantastic. We also do monthly calls, not just for women's health advocates like today, but also for the breast cancer early detection group. And so that will be on July 9th. And then on July 10th, we're doing something that we will be doing again when on Capitol Hill, but we're going to go through the how-tos of advocacy. And this is something that will be, again, an open webinar for all, where we'll walk through the steps of advocating. And there's certain things that that we'll then repeat again in some of the events we're doing, and I'll touch back on that in a moment. And then Liz went through the agenda for July 16th, and we look forward to seeing many of you there. But then for some of the other activity that we're doing, we're starting to put dates in the calendar for the fall. The summer is going to be pretty hectic for most. So while we may try and do a local thing here or there, we're really looking forward to a big fall initiative. And some of the dates are listed below. Those are not, again, exclusive dates. There will be more added to the calendar as time goes on. And you'll be able to sign up for these events via our website. And we will be communicating through our newsletters. So please open and click there and share, again, with friends. The idea is to really build a community across the country who's eager to advocate, to learn, and to network, because we've really found in the events that we've hosted so far that it is an amazing ecosystem, and there's a lot to be learned from one another. Next slide.
Oh.
So I mentioned that we were doing calls in among various groups. Here are the ones that we have identified so far. And if you'd like to be involved in any of these groups, again, please either message us in the chat or send an email to info at or comment on LinkedIn to one of us because we'd love to build these groups, these local groups, to fortify the advocacy things that we're doing. And some of the things that have been proposed in different cities and that we'll be sharing, so there'll be best practices and events can be replicated in different areas, are things like virtual happy hours, which is kind of a lighter lift initially to attract more people, then live happy hours, perhaps with postcarding, and we would supply the postcards and the message and the markers, but it gives people a chance to have impact that very moment. Also, other things like boxing or hiking that are open to all. And then there are the other events that will have more formal programming, like panel discussions. We'll invite guest speakers. We'll sometimes try and attract celebrities. And if you have any contacts to anyone in the sports world, political realm, Hollywood, whatever you consider to be a named individual who might speak passionately about this cause, we'd love to speak to them. So please share their names with us or make an introduction. And the objective here again is to build our community of advocates, to build the number of members we have on our steering committee that help direct some of the agenda and the issues that we're focusing most intently on, and also to invite sponsors to get behind this initiative to support the work that we do. And Seattle, San Antonio, Rochester, and Phoenix, we've had some interest from people in each of those markets. We're looking to build out with a few more individuals before we start structuring calls. But if you are in any of these areas or if you have friends that you think might want to be involved, please let us know. We've also set up WhatsApp groups, and I will be messaging them all today. I think they're up and running as of noon. So we'll be able to communicate quickly, efficiently, and be able to track things with our respective groups. Next. Vanessa, take it away.
I will go off mute. So we are so excited that so many people have been sharing organically why they are so passionate about women's health. We are with you and we want to amplify that. And we also want to join together. So we have an opportunity for you to share your why for women's health, or why you're joining this coalition. And one of the ways you can do that is by filling out a template that we have created. I think Madeline's gonna click. There we go. You saw me first. And what you can do is you can just click on the template. There'll be an example of how to do this. This was someone who has filled this out already, April Haberman, and she really shared passionately about why menopause is so important to her. And she can post this, and then we can repost this. And we're so happy to have her as part of our community. Who else have we had share? Annette shared also passionately about heart disease, which we know is our number one killer. And, she is very passionate about this, and we're happy to have her part of the community. And I think we might have one more. Yes, we do, Melissa. And I loved how she started with "We rise together, women's voices were never the problem. The structures that silenced us are." And so we want you to be able to share your why too. Next slide. And so here's how you can do it. How to participate. You can go to the Canva template link, which we are going to put in the chat, and we will also send it in the follow-up email. And this is what you're going to see when this pulls up. You're going to see this little thing that says, "I've created a template for you, view template," and all you have to do is upload your photo and then upload your information and download it and share it wherever you'd like. Whatever platform you're on, share it and then tag us. The two platforms that we are active on are LinkedIn, Women's Health Advocate. So if you're not following us, please follow us. And we just launched the Women's Health Advocates Instagram. So we are getting that up and running, thanks to Madeline, at Women's Health dot advocate. So please, please, please follow us. And if you share on Instagram, please tag us. Thanks. Next slide. So, what can you do? There are a bunch of things that you can do to get involved. Liz has already mentioned many of those things, as has Leslie. You can send an advocacy letter on the breast cancer bills using our online advocacy tool. When you go to the website, it will say send a letter. You literally just click send a letter. You can choose the letter that you want to send. We've populated all of the important information and the details that you might not know. And then you get to populate the most important information, which is your why, your lived experience. And then you hit send. Get friends to sign up for Women's Health Advocates. We are just blown away by the number of people that continue to join these calls and to take time out of their schedule to be on these calls. And we are so grateful to be a part of this community. And we want more people to know about it and to join. We want you to register for upcoming events. It's super important that we know who's coming. It helps us plan. We want leaders. We can't do this alone. So if you are really passionate, and I just had someone, message about New Jersey, if you're passionate about New Jersey and you want to plan an event there or be a part of a New Jersey coalition or your state coalition, please reach out to us at info@womenshealthadvocates.org. And of course, lastly, join the steering committee. This is what helps fund everything that we do because none of this happens on its own. As you could hear from Liz, so much happens behind the scenes. With the steering committee, you also get a say in what we're doing and how we're doing it and why we're doing it. So we want you to be a part of it. Next slide. And
So
I
we're happy to take your questions. I'm seeing them come up, and I have been posting in here all these links for everything. I'm going to repost it again so that people can register for these events. And the first question is about the July 7th Women's Health Research event. Yes, all our webinars are recorded, but to ensure that you get a copy sent right to your inbox, please register RSVP for that because that will guarantee that you get that right in your box. And that's going to be an awesome event. So please register. Please help spread the word. We'd love to see postings about getting people to join us and in these various events. So there's that. What's the relationship between this group and Milken Institute's Women's Health Network? Um, Thanks for the reminder, chaired, sorry, by former First Lady Jill Biden. Thanks for the reminder on that. I need to fill out a form. I've been asked twice now to fill out a form for that so that um, to be part of that network. So I will do that. And I've also friends with Esther, and we're working on meeting up for lunch soon. So we are collaborating. We talked with them before they made the announcement, and we are collaborative and friendly. At this point, I don't think there's much more detail yet, but yeah, we're definitely on each other's radars. And Esther came to our April 29th congressional briefing on CMS reimbursement discrimination and how it's impacting women's health. And she was really impressed with that. So I think she's excited to team up with us. They were going to come on the 21st, but then could not come last minute. So, okay. Will the cuts also apply to the FDA? If so, how much will these funding and staffing cuts slow the approval of highly innovative medical devices going through the de novo process? Yeah. Um, So yes, there are cuts across the board. What's interesting about FDA though is that we have the user fees that help quite a bit. We have a secretary who really opposes industry having any kind of influence in FDA. So that's what's making it challenging. And if you keep cutting, then you're going to slow down innovation. You're not going to be able to get approvals through. So it's definitely a problem and a challenge. But we have seen when they did cut folks with all the firings, they actually hired them back, many of them back. So I think that they are seeing the need at FDA, but I think that, yeah, there's definitely concerns there. What's the exact number in this budget and this reconciliation package? I don't know off the top of my head for FDA, but that's a funky one because it's got user fees as well. And they have to negotiate the new user fees agreement as well. So that's underway too.
We
Uh,
did have one other question that I
Oh,
mistakenly pushed that we answered, but we didn't answer. And it says, do we have any info on the CDC cut specifically on the Center for Cancer Prevention and Control?
well, I know that CDC is getting decimated. We've all been seeing what happened with the whole vaccine panel, which was crazy, and it does impact cancer because people are working on cancer vaccines. So sort of over here, we're also working to educate on vaccines and how they work and why they're needed, but especially in the cancer space. But as far as that specific one, I don't know what happened with that specific one. What's interesting with the budget with this bill, it doesn't go into the weeds on details. It's the top line numbers. More of those details come through in the authorization bills and then in the appropriations bills. So the Labor Health and Human Services bill is the one that would have jurisdiction there, and they have not marked that bill yet. They're expecting to do that the week of the 21st. So, yeah. It's 12:30, so if there's one last question, we can get that question in. And if not, we will shift over to our steering committee. If you're on the steering committee, you should have the link. I made sure I updated that, but I missed it. So if you're on steering and you don't have the link, email me right now and I will make sure you have that. I'm putting it in there. Okay. Just shoot me an email if you don't have that. Okay. And please register for our events. Please spread the word on the events. Please post on social media, always using our handle when you can, and then send those letters. It really makes a difference. Remember last month we talked about 1,000 letters in 1 month. That's unprecedented. That's huge. It makes a huge difference. So please, please, please keep it up. And you know how to reach us, info@womenshealthadvocates.org or me directly. We are here to help and we appreciate you. Thank you.